I'd say 2017 was remarkable for a resurgence of opposition we haven't seen in the past 15 years or so at the federal level.
They came at us trying to repeal the DC law and trying to make inroads in an effort to roll back the progress that we made in every state.
Our outreach to the faith community has really provided an opportunity to engage faith leaders in the fight to protect the DC law. So we gathered around 59 names of faith leaders representing 14 faiths and 23 states who all wrote this letter to tell Congress that DC residents should have this right. This year we launched our African American Leadership Council, and they have come aboard to help Compassionate Choices really strategize the outreach that we're working on.
We've also just held a large-scale briefing on Capitol Hill, which included 60 participants as well as 20 different congressional offices, which is the largest that CNC has had in the time that we've been lobbying on Capitol Hill. Finally, we're reaching out to every office individually to speak with members of Congress and their staff to educate them on medical aid in dying. This is in conjunction with the digital teams who are reaching out to individual constituencies and the field teams who are reaching out to members of Congress to let them know that they should be supporting medical aid in dying, whether they're in an authorized state or not.
My favorite moment of 2017 was that we were finally able to let the residents of DC know that they now had access to end-of-life options.
And since Congress has begun to fight that law, we have seen our advocates such as Dr. Omega Silva and Congresswoman Eleanor Holmes Norton really come out vocally in support of DC residents having that right. This year, Congresswoman Norton hosted a panel where she invited Compassionate Choices to come speak about medical aid in dying and why it's so critical to the residents of DC.
This was a year of successes and overcoming challenges. But I think my favorite moment was probably celebrating the 20th anniversary of the Oregon Death with Dignity law coming online, because it was an opportunity to celebrate all that we stand for in end-of-life choice and all that we've accomplished over the last 20 years.
With your face to the wind, I see you smiling again.
Oregon has taught us so much how potent shifting the power, shifting the decision-making from physicians to patients is, how potent that is in transforming the whole medical care system and reforming how medical care is delivered.
2017 has been an incredible year where we have built a strategic impact committee of high-profile, well-respected people from across the country who are lending their time and their talents to helping us develop a vision for the future of this movement.
We've also developed the Latino Leadership Council, and through that outreach we've been able to really engage the Latino community in this conversation as well.
The National Hispanic Council on Aging endorsement of medical aid in dying is a huge win for Compassionate Choices. And when the Latino community sees someone that looks like them and speaks like them, they feel that it's okay for them to speak up as well.
The growth and the progress that we've made with our access campaigns this year has been nothing short of spectacular. This year, California and Colorado both saw their first full year of implementation. And I'm really proud to say that with the support of our 15 action teams and our 2 medical provider advocate teams in those states, all of the large secular healthcare systems have adopted policies supportive of patient end-of-life choice.
In 2017, we saw state medical societies drop their opposition to medical aid in dying. And we saw one state medical society move from neutral to supportive. Through our Truth in Treatment initiative, we launched a new tool called the Diagnosis Decoder. What this tool does is it empowers patients with the right questions to ask so that they're able to get full information from their doctor and can make treatment decisions that are consistent with their values and priorities. That's the kind of transformation that we are creating in the medical society and in our country.
It's very important for Compassionate Choices to be active in U.S. courts, in state courts, everywhere where there is a challenge to those principles. One of the most important is the challenge to the California law, and we were successful in enabling that law to continue unimpeded while the case goes forward. That's a very important victory. And we're also involved in Vermont in pressing back on a challenge to that law and other cases throughout the nation.
Everything that we did in 2017 was about protecting the castle. It was about making sure that the gains that we've worked so hard for these past several years continued. The key to our success in 2017 has been the incredibly generous support of our donors, our volunteers, and our storytellers.
From our hearts, from all of us at Compassion and Choices, thank you so much.